This is Jim Engster. You're listening to 89.3 WRKF in Baton Rouge. 297-5633 is your number. And WRKF is now available to have your voice heard through Twitter. So you may tweet us at WRKF using the hashtag Jim Engster. Two gentlemen from Baton Rouge General Hospital are with us in studio. Dr. Antoine Keller, he is Chief of Cardiovascular Surgery. And Edgardo Tenriero, he is Executive Vice President, Chief Operating Officer of the hospital. Good morning, gentlemen.
Good morning, Jim.
And first of all, let's talk about what you do, Dr. Keller, as Chief of Cardiovascular Surgery. We have a community that in a nation, but particularly in our area, we have some challenges as far as how we take care of ourselves, and I'm sure business is brisk based on what you do.
Well, unfortunately for the community, it is brisk, but fortunately for us, we have been given the tools to be able to do what we do and to bring the community up to the level of care that it deserves. Cardiovascular disease is the #1 cause of death in America and certainly does lead the roll call with regard to Louisiana. So it's important for us to be able to have the tools that we need to be able to take care of people in this area.
What are the new tools?
Well, Mr. Tenriero can tell you about the Baton Rouge General expansion, but I think by providing access to technology, you can ensure that the community gets the level of care that it deserves. And there have been a number of developments in the past several months that have proven Baton Rouge General's commitment to providing this kind of care to this community. The expansion of the operating rooms at the hospital, the inclusion of robotic technology and minimally invasive technology will all serve to raise the level of care in this part of the country. And one of the things that providing this kind of technology does for the community is it allows the community to attract the kind of talent that is able to put this technology to the best use. And we have physicians in this area that have trained at places like Vanderbilt University and Duke University, and indeed internationally at the Kirchhoff Clinic in Germany and at the Leeds General Infirmary in England. And all of these things have come about because of Baton Rouge General's commitment to increasing the level of technology and cardiovascular care here in this community.
297-5633 is your number. Cardiovascular Tower was built on the campus of the hospital last year, or actually earlier this year. And in studio, Dr. Antoine Keller, Chief of Cardiovascular Surgery at Baton Rouge General, and Edgardo Tenriero, the Executive Vice President, Chief Operating Officer at the hospital. You mentioned, Dr. Keller, about robotic technology. How is that helping in combat heart disease?
Well, as you can imagine, taking care of people with cardiovascular disease is sometimes a very invasive process. In order to get to the heart inside the chest, oftentimes we have to perform a sternotomy, which is cut straight down the middle of the chest, open the chest to expose the heart. Well, minimally invasive technology and robotic technology allows us to access the heart without making these very large incisions, with smaller incisions which lead to a lot less pain afterwards.
So you can do a bypass without doing the kind of invasive procedure that you did in the past?
Yes, it is possible to do bypass surgery, valve replacement surgery, lung surgery, all of these things using minimally invasive and robotic technologies that we really couldn't do before the last several years.
What is the biggest culprit for heart disease? Is it heredity? Is it lifestyle? What is it?
Yeah, I always tell the patients that you can't pick your parents. So actually, genetics plays a very significant part in the progression of cardiovascular disease, but certainly lifestyles. In Louisiana, we have an interesting lifestyle. It's not necessarily bad, but it certainly is bad for your cholesterol level and your hypertension and so forth. Smoking is probably a bigger factor than anything else that is modifiable. And certainly if you give up smoking, that could save your life or certainly prolong your life significantly.
Congressman Cassidy, who lives not too far from your hospital, has been on this show many times, usually opining about politics, but occasionally on health. He says losing 5 or 10 pounds can make an amazing difference in a person's health.
Yes, I think losing a little weight and exercising on a regular basis, getting your heart rate to above 75% of your projected maximum heart rate 7 days a week, as recommended by the American Heart Association, can certainly have an impact on your longevity and your progression of cardiovascular disease. And a little red wine doesn't hurt either.
Red wine, what about other alcohol?
Well, we usually tell people they can have one drink per day. That's one glass of whiskey or one beer or one glass of wine, not one bottle. And that is generally good for your high-density lipoprotein cholesterol, one of the most important things that determines whether your atherosclerotic disease progresses quickly or not.
And Kevin says, he reminds me that they serve red wine at Shady's. But the guys who were there that night, at least 2 weeks ago, they have other issues other than cardiovascular ones right now. But
indeed.
But occasionally alcohol has a downside.
It's moderation.
What is moderation, though?
One glass a day.
One? I've heard other doctors on this show say 2. You're saying
actually,
1.
If you're a man, 2 is okay. If you're a woman, then they recommend you
now
stop
that's a
at 1.
sexist remark.
It's fact, actually.
Even if they're the same size? If you have a 150-pound man and a 150-pound woman, a man can drink more alcohol than the woman?
I'll do a little research on that and get back to you, Jim.
You were trained at Duke University.
Yes, sir.
One of the great universities in this great land and noted for its medical training. How does the education for a guy like you compare there with those, many of your colleagues, of course, were educated right here in the great state of Louisiana?
Well, I think that Louisiana has such a high incidence of cardiovascular disease, and we have such a wide experience in taking care of patients with cardiovascular disease. I think it compares remarkably well and even surpasses the education that you can get in North Carolina in some regards because of the fact that we have such a significant proportion of the population with cardiovascular disease. You do things enough, you get really good at them. So,
a listener has asked, and we're going to get to Edgardo Tenriero in a moment, but a listener has asked a question to you, Dr. Keller, about this haze that we've been having over Baton Rouge. Is it healthy to go out and exercise in this right now?
I think that in general, you should try to avoid, especially if you have respiratory problems, try to avoid situations in which you have a lot of smoke and haze in the air. But you should let your body be the judge. If you start to feel bad, then I suggest that you take a break.
What about walking? What about walking through it? Even walking through it is a bit uncomfortable right now.
Well, a lot of people complain about the heat as well, so perhaps you should find a place to walk indoors.
All right. 297-5633 is your number. Dr. Antoine Keller, Chief of Cardiovascular Surgery at Baton Rouge General, and Edgardo Tenriero, the Executive Vice President and Chief Operating Officer, an alum of Notre Dame. And a man who has a bow tie collection to rival that of Nathan Fisher. And you're wearing Notre Dame colors, too,
yes.
So I'm impressed. Now, as far as Dr. Keller was talking about the robotic technology and all the latest gadgets that you have at the hospital, how important is it for you to stay ahead of the curve as far as technology and having the facility that's needed to treat people?
Well, we try to not stay too far ahead of the curve, but just close enough to the leading edge so that it's not the bleeding edge, so to speak. So these technologies that we're talking about, robotic and the hybrid operating room, which in essence is a cath lab inside an operating room theater that allows a surgeon and the cardiovascular team to perform procedures that in the past we haven't been able to perform. These are technologies that truly get us close to that leading edge technologically, and it's critical that we stay abreast of those technologies so we can provide the tools that these physicians need to take care of patients. We like to think ourselves as in essence, architects of relationships between physicians and patients, and to facilitate the work that these physicians do.
Now, Baton Rouge General has been touting something called a hybrid operating suite. How does this work?
Well, in essence, a cath lab is a traditional theater in which cardiologists have performed many of their procedures on patients. And as the pace of technology has advanced, both the operating room theater and the cath lab theater have been merging over the last several years, and these allow the patients to receive is the care that they receive from a cardiovascular surgeon, and at the same time the care that they receive from a cardiologist, all in the same room, so that patients don't have to go from one room to the other. Everything happens in one operating theater.
Okay, 297-5633 is your number. Question online from Kimberly, who asked Dr. Keller that, is it possible to address clogged arteries or prevent them through the use of other products other than alcohol or wine? She suggests grapefruit juice. What do you say to those who say that there are ways to go without consuming alcohol?
Yes, there are a myriad of dietary modifications that can lead you to have an improved good cholesterol, or HDL, and to reduce your bad cholesterol, or LDL. I suggest you consult your personal physician to try to figure out what the best combination would be for you, because as I'm sure you know, there are a lot of dietary modifications that aren't necessarily good for every patient. It's a very individualized process, and I think Dr. Bob Sanamon at the Baton Rouge General is an expert in trying to determine what kinds of cholesterol modification treatments are good for what certain patients. And he does have a lipid clinic that he has just started at the Baton Rouge General that takes care of primarily patients with lipid issues. And that's one of the other ways that I think Baton Rouge General is trying to change the paradigm of taking care of patients with cardiovascular disease by centralizing these services.
Does grapefruit juice work?
It does.
It does?
Yes, sir.
It works as well as wine?
In different ways.
All right. Malara near the Capitol asks about your 1 glass a day. She says, how big of a glass?
8-ounce glass.
8-ounce glass. So 8 ounces of wine is okay. 1 glass a day.
Oh, I thought you were referring to the grapefruit juice, Jim.
No,
That's
well,
actually
8 ounces of wine.
4-ounce glass of wine.
4 ounces of wine. Okay. 8 ounces would be like 2 drinks. We're back to 2, but he said, Dr. Keller says go with 1. Now, you mentioned HDL and LDL. What's the best ratio for those, the so-called good cholesterol and the bad stuff?
Well, I would defer to Dr. Sanamon for that because he's the expert. I'm a pretty good cardiac surgeon, but the lipid recommendations from the American Society of Lipidology change very frequently, and I think that it's important to have your total cholesterol and the ratio of your cholesterol, different kinds of cholesterol, checked on a regular basis, especially if you're on medication for that.
But if a person has a high level of the so-called good cholesterol, HDL, does that enable them to have higher quantities of the bad stuff because supposedly the good cholesterol is fighting off the bad stuff?
Well, what most physicians will tell you is that your HDL can never be too high and your LDL can never be too low. And to increase the ratio of HDL to LDL in favor of HDL is definitely beneficial for patients.
All right, another listener, this one from Kevin, is it Shenya? Shenya wants to know about glucose levels. How much do high glucose levels contribute to heart disease?
Well, there are certain issues that accompany high glucose levels, which include increased inflammatory mediators in your bloodstream, which can contribute to a worsening of atherosclerotic disease. And diabetes is certainly one of the most important factors with regard to the development or the progression of atherosclerotic disease. And we found that by keeping the glucose levels in your bloodstream under very tight control, you can prolong your time until you have a significant coronary lesion and reduce the time at which your atherosclerotic disease progresses. So it's very important. Diabetes and hypertension control are probably the two most important factors that contribute to the progression of atherosclerotic disease, other than genetics, of course.
Well, the weight that a person carries around can have a great deal to do with glucose levels, can it?
Yes, sir. There are a number of metabolic issues that happen when people are overweight. Metabolic syndrome is one that's been in the news a lot lately that deals with insulin resistance. And certainly the community and the United States in general, the population is more and more obese every year. And this is a very important thing to try to combat atherosclerotic disease.
And what about elevated triglyceride levels?
Triglyceride levels, lipids in general, and cholesterol levels are all eminently important in the progression of atherosclerotic disease. And certainly we have a very high incidence of triglyceride level elevation here in this community, primarily because of our dietary habits.
Okay. Well, yesterday, Baton Rouge General announced plans to proceed with approximately $40 million in physician-driven expansion projects. And as we close the hour, I think our other guest, Dr. Edgardo Tenriero, can comment on this. By the way, is it doctor?
I'm not a doctor yet, but
I'm promoting you.
I do stay at a famous hotel chain when I travel.
I bet you look good in a white coat with a nice bow tie too. But as far as the $40 million expansion, what will this do to help your cause?
Well, the first item there is the operating room expansion, including the hybrid room and the robotic technology. That's about $10 million. We will build 4 additional operating rooms, one of which will be this hybrid room, and another one would be for the minimally invasive robotic technology. And the rest of the funding, the $30 million, will be for a medical office building expansion directly adjacent to the Pennington Cancer Center and the Bluebonnet campus. So what this is going to allow us to do is provide a lot of these space for physicians.
Well, thank you, Edgardo Tenriero and Dr. Antoine Keller. Thanks, everybody, for listening. We'll be back tomorrow. Until then, stay tuned.
Podcasts of The Jim Engster Show are available at WRKF.org. The Jim Engster Show is produced in association with the Louisiana Radio Network and is copyrighted by WRKF for the private use of its audience. Any other use of any portion of this program without the written consent of WRKF is prohibited. The views expressed on this program are those of the participants and do not necessarily reflect the views of WRKF, its officers, and members.